Let me ask you something important. If you're over 60 and living with diabetes, did you know that what's on your plate today could decide whether you have a stroke tomorrow? Most people think strokes come out of nowhere, but for diabetics, they rarely do. Tiny choices you make in your kitchen, the bread you pick, the oil you use, even that snack before bed, can quietly protect your brain or push you closer to danger. Hi, I'm Dr. Matthews. I've spent over 30 years helping older adults take control of their health. And today, I want to help you do the same. In this video, I'll show you the best foods to eat, the worst ones to avoid, and I'll even give you a simple daily meal plan that lowers your stroke risk, all backed by real science. So grab a pen, grab a cup of tea, and let's get smarter about what you eat. Because food isn't just fuel, it's your medicine. Most people think a stroke strikes without warning, like a bolt of lightning, but here's the truth. For diabetics, a stroke is often the result of years of silent damage inside your arteries. The good news? Your daily food choices are one of the strongest shields you have to lower this risk. Let's start with why diet is so critical. Diabetes damages your blood vessels over time. High blood sugar can make your arteries stiff and narrow. Combine that with high blood pressure or high cholesterol, both common in older adults, and the risk of a clot blocking blood flow to your brain goes way up. But here's the powerful part. Studies show that people who focus on the right foods can lower their stroke risk by 20% to 30%, even with diabetes. One major study published in the journal Stroke followed over 200,000 people for more than 20 years. Those who ate a diet rich in whole grains, fruits, vegetables, nuts, and fish had a significantly lower risk of stroke, even when other risk factors like age or weight were considered. So, what should you eat more of, and what should you cut back? First, let's tackle the foods you want more of. And I'm not going to just throw out a list. I'll explain why each one helps. 1. Leafy greens, your daily artery cleanser. Spinach, kale, and collard greens are packed with nitrates, which help lower blood pressure naturally. High blood pressure is the one-to-one cause of strokes. One study in the American Journal of Clinical Nutrition found that people who ate more leafy greens had 12% lower risk of stroke. If you don't like raw greens, add a handful to soups or sauté them with garlic and olive oil. 2 berries, tiny but mighty. Blueberries and strawberries are rich in antioxidants called flavonoids. These help reduce inflammation in your blood vessels. A Harvard study of over 70,000 women found that eating just 3 servings of blueberries and strawberries each week cut stroke risk by 32%. Fresh or frozen, it doesn't matter. 3 whole grains. The good carbs. Many diabetics fear carbs, but not all carbs are equal. Whole grains like oats, quinoa, and barley are high in fiber, which helps control blood sugar and cholesterol. A Swedish study found that people who ate the most whole grains had a 27% lower risk of stroke than those who ate the least. So swap white bread for 100% whole grain, or start your day with a bowl of unsweetened oatmeal. 4 fatty fish, nature's blood thinner. Salmon, mackerel, and sardines are rich in omega-3 fats that reduce clot formation and lower triglycerides. The American Heart Association recommends eating fish at least twice a week. One large study found that people who ate fish regularly had a 12% lower risk of stroke. If fresh fish is pricey, canned salmon or sardines are great, budget-friendly choices. 5. Olive oil, liquid gold. Extra virgin olive oil is packed with healthy fats that reduce inflammation and protect your arteries. In a French study of older adults, those who used olive oil daily had a 41% lower risk of stroke than those who didn't. Use it for cooking, drizzle over salads, or dip whole grain bread in it. The bottom line: these foods are simple, familiar, and proven to work. I know change can be hard, but you don't have to overhaul your diet overnight. Start by adding just one of these foods to your meals this week. Maybe swap butter for olive oil or toss a handful of berries on your morning cereal. In our next part, I'll share the foods you must avoid, even if you think they're harmless, and I'll explain how some so-called healthy foods might actually raise your stroke risk. So stick around, because knowledge is power, but action is what keeps you safe. Welcome back. Dr. Matthews here. In part 1, we talked about what to eat more of. Now let's tackle the harder part: what you need to cut back or avoid altogether. It's no fun to hear, "Don't eat this," but I want you to remember, every food you skip today is one less step towards a stroke tomorrow. 1. Processed meats. Silent artery cloggers. Bacon, sausage, ham. They're tasty, convenient, and terrible for your arteries. A large European study found that people who ate 50 grams of processed meat daily, that's just 2 slices of bacon, had a 23% higher risk of stroke. Why? Processed meats are loaded with sodium and preservatives called nitrites, which raise blood pressure and damage blood vessel linings. Swap that morning sausage for an egg or Greek yogurt instead. 2. Sugary drinks. The sneaky blood sugar bomb. You might think a can of soda or sweet iced tea isn't a big deal, but sugary drinks spike your blood sugar fast. They also add empty calories, which lead to weight gain. Another stroke risk. The Nurses' Health Study found that people who drank more than 1 sugary drink a day had a 16% higher risk of stroke. Water, unsweetened tea, or sparkling water with a splash of lemon are better choices. 3. Refined carbs. White bread, white rice, pastries. These foods cause quick blood sugar spikes and drops, which damage your blood vessels over time. In fact, research shows that a high intake of refined grains is linked with a 33% higher stroke risk compared to whole grains. Switch to brown rice, quinoa, or whole wheat bread instead. 4. Too much salt. The hidden enemy. It's not just your salt shaker. It's processed foods like canned soups, frozen dinners, and takeout that pack hidden sodium. The CDC says Americans over 60 should aim for less than 1,500 milligrams of sodium a day. That's just about 2/3 of a teaspoon. Try seasoning with herbs, garlic, or lemon instead of salt. 5. Trans fats, the worst kind. These are still found in some baked goods, fried fast food, and margarine. A large meta-analysis found that trans fats can raise your risk of stroke by up to 23%. Check labels. If you see partially hydrogenated oil, put it back. Be smart with so-called healthy foods. Be careful with low-fat packaged foods. Many are loaded with sugar to make up for lost flavor. Instead, focus on whole, simple foods you can recognize. Fruits, vegetables, nuts, seeds, whole grains. Small swaps, big wins. Here's the good news. You don't have to be perfect. Even cutting back a little can lower your risk. Try this. Replace your afternoon cookie with a handful of nuts. Have fruit for dessert instead of pie. Cook at home more often, so you know exactly what's in your meal. Remember, every bite is a choice, and every good choice today keeps your brain safe tomorrow. In part 3, we'll pull it all together. I'll share a simple day's meal plan for diabetics over 60 that supports brain health and keeps stroke risk low. I'll also answer the number one question I get. Can I still enjoy my food? Stay with me. You're doing great. Hi again. Dr. Matthews here. You've made it to part 3. And now it's time to put this knowledge into action. A lot of my older patients say, "Doc, all these lists are helpful, but what does a good day of eating actually look like?" So today, I'll walk you through a simple, delicious daily plan for diabetics over 60 that can help lower your stroke risk without making you feel deprived. Breakfast oatmeal with berries and nuts. Start your day with a bowl of steel-cut oats. Top it with a handful of blueberries or strawberries and a sprinkle of walnuts or almonds. Why it works. Oats equals fiber that helps control blood sugar. Berries equals antioxidants that protect blood vessels. Nuts equals healthy fats to keep you full and your arteries happy. Have a cup of green tea or black coffee. Just skip the sugar. Lunch. Salmon salad with leafy greens and whole grain bread. A fillet of grilled salmon over a bed of spinach, kale, or mixed greens. Add tomatoes, cucumbers, a drizzle of olive oil, and a slice of 100% whole grain bread. Why it works. Salmon equal omega-3s to prevent clots. Greens equal lower blood pressure. Olive oil equal reduces inflammation. Add a glass of water with lemon. No sugary drinks. Snack Greek yogurt with a few nuts. Low in sugar, high in protein, keeps you satisfied until dinner. Dinner. Quinoa stir-fry with veggies. Cook quinoa and toss with sautéed broccoli, bell peppers, carrots, and tofu or chicken breast. Season with garlic, ginger, and a splash of low-sodium soy sauce. Why it works. Quinoa equal whole grain that stabilizes blood sugar. Colorful veggies equal fiber and nutrients for heart and brain health. Evening tip. If you crave something sweet, have a piece of dark chocolate, 70% cocoa or higher. It's rich in flavonoids and okay in small amounts. How this meal plan helps your getting. Plenty of fiber to manage blood sugar. Healthy fats to protect your arteries. Low salt, no trans fats, no hidden sugars. Flavors you actually enjoy, so you'll stick with it. I know change isn't easy, but stroke prevention is worth it. A better diet means fewer pills, fewer hospital visits, and more time enjoying your life and loved ones. So, here's my challenge. Try this plan for just 1 week. Notice how you feel, then build from there. If you've made it this far, I hope you feel more confident, because preventing a stroke doesn't start in the hospital, it starts in your kitchen. Remember, you don't need a perfect diet, you just need better choices, one meal at a time. and each good choice adds up. If you found this video helpful, please share it with someone you care about, your spouse, a friend, or a neighbor who's also living with diabetes. And don't forget to subscribe for more practical health advice that actually makes sense for real life after 60. I'm Dr. Matthews. Thank you for trusting me to be part of your health journey. Take care of your plate, take care of your brain, and I'll see you in the next video.